Myself, Professor Pawar VK from Department of Geography, J.A.T Art, Science and Commerce College for Women, Malegaon. On behalf of this video presentation, I welcome you all.
National HIV testing strategies involve ELISA enzyme-linked immunosorbent assay test, which is performed on the serum using laboratory-based equipments. Recently, the first ever rapid home test kit for HIV, OraQuick, has been approved in USA. It analyzes saliva and result is available in just 20 minutes. The two blue lines indicate HIV positive. The kit is very simple. Now we'll deal with the AIDS. AIDS is the abbreviated form and its full form is Acquired Immunodeficiency Syndrome, what we call it as AIDS. AIDS has been defined as any sign or symptom of acquired cellular immunodeficiency in a person having confirmatory positive HIV tests. Symptom of AIDS. The term syndrome is used to refer a jumble of symptoms. Symptoms of the disease AIDS include loss of appetite and weight, constant fever, prolonged fatigue, diarrhea, constipation, changing bowel patterns, swollen glands, chills with excessive sweating, lesions in the mouth, sore throat, persistent cough, shortness of breath, skin rashes, tumors, headache, memory lapses, swelling in joints, body pain, vision problems, regular feeling of lethargy, ill health, etc. HIV positive persons are susceptible to various types of cancers, including KS, that is Kaposi's sarcoma, which occurs in the mucous membranes of the eyes, nose and mouth. Now, we'll deal with the mode of transmission of AIDS. How does this AIDS is transmitted from person to person? HIV is transmitted mainly by unprotected anal, vaginal or oral sex with an infected partner, by sharing contaminated injection needles used in infected person for drugs or blood transfusion, or cuts due to shared blades or razors, or from infected mother to child through pregnancy or breastfeeding. Unprotected sex with multiple partners, infected semens, infected vaginal fluids, infected blood and blood products, and infected parents are the primary sources of HIV transmission. Studies reveal that needle sharing and receptive anal sex appear to have the highest risk, with transmission rates estimated to be between 1% and 3% per exposure. Occupational needle stick injuries, receptive vaginal sex, insertive and or vaginal sex, and receptive oral sex have estimated transmission risk more than 1% per exposure. Most efficient is infected blood transfusion, while most transmissions happen through sexual contacts due to the frequency of acts. HIV particles are not transmitted by water, air, mosquito bites or superficial contacts with diseased persons. The viral particles are fragile and short-lived outside the host. AIDS is not an infectious disease, rather it is a type of contagious in nature. That is why it can not be transmitted through air by sneezing, coughing or breathing, water, sharing swimming pools or bathtubs, casual physical contacts, touching, hugging or kissing, toilets, sharing or through mosquito bites. Now see the course of infection. The course of infection involves three stages. First stage is the primary HIV infection. During first stage, lasting for 1 or 2 weeks, the HIV particles replicate rapidly in the host cells. Some persons may experience a variety of symptoms such as flu-like illness, fever, sore throat, enlarged lymph nodes, rashes, malaise, muscle and joint palms, etc. Standard HIV tests normally remain negative. Second is the asthmatic phase. It is second phase of HIV infection which lasts for 8 to 12 days. Viruses without producing symptoms continue to replicate and reduce the number of helper T cells. However, irregular symptoms related with defective immune system may appear